kind of here to recognize some nurses and you know, the job that the hospital does. I know that, you know, the recognition for the hospital and all those healthcare workers is also coming up. So kind of a little bit, if you could, tell us about nursing and the value and why that's important, really.
Absolutely. Well, the nurses are that first person that the patient experiences in the healthcare setting, whether that be in a clinic setting, in the public, with community health and public health, and in our hospital, and generally like in the emergency department and then on into the inpatient unit. And our patients spend the most time with the nurse. So we're carrying out all of the orders of the physician to help them medically, but at the same time we're handling social and sometimes even spiritual needs.
All right. So, I mean, services here at Mahaska Health have continued to grow and expand, and the diversity of nurses then also, so that what they need to know and bring to the table probably also continues to push their boundaries.
Right.
Can you tell me a little bit about some of those expansions and how that's, you know, playing out here at the hospital a little bit?
Yeah. So, especially during Nurses Week, it's a really great time to celebrate our nurses and the education that the nurses have, or opportunities for furthering education to be able to take care of the more complex patients that we see in our community. And it's definitely a shift as we have added additional services in the organization. And some of the patients that we have kept in our facility that over, you know, years ago we would have transferred to larger facilities, being able to take care of patients that are more critical. So today, one of the things that we did today was we had a nursing education fair where we had local colleges and universities around the state of Iowa come in, give the opportunity for our nursing staff and anyone that aspires to be a nurse to visit with different colleges on how they can go back to school and further their education, whether they're pursuing a bachelor's degree or even a master's degree. And then we offer a lot of different classes within the organization to try to enhance the learning of our nursing staff to be able to take care of those more complex patients.
We also, I'll just tag on to that, we have a lot of nurses that have furthered their education and they're now advanced nurse practitioners. So a lot of our providers are nurse practitioners, and some of those have specialized in areas, especially allergy, immunology. We have some that are working in neurology and soon rheumatology. And so just some of those other areas where we can provide some specialized services, and those people are great to do that just because of experience they have through training and also experiences that they've had working with other providers. So a lot of those advanced nurse practitioners are covering some of those areas too, where we may not have so much need, but when the need arises, we can take care of some of those specialty areas too with those providers.
Mm-hmm.
Okay. So, and I'm going to clarify here, how long is Nurses Week, month, year? What do we got going on here for sure?
The American Nurses Association recognizes it now as Nurses Month. It started out as National Nurses Day, which typically would be May 6th, which is the birthday of Florence Nightingale. And then it became National Nurses Week, starting on the 6th of May, going through the 12th. And it's now celebrated as National Nurses Month.
Well, I was going to say, it probably takes a really special person to be a nurse. I mean, you're here helping people sometimes through the most joyous day they have, the birth of a child or something like that. And then, of course, you're there for those tough times too. But those things, talk about that emotional roller coaster of being a nurse and being there to help people every day. Because I mean, that's what we think about when we think of nurses, is that caring. And do you think that takes a special person to do that?
It does take a special person, but it takes a special person really to do anything in healthcare, not just nursing. Mm-hmm. Our laboratory staff, our radiology staff, therapy staff, be a physician, be a nursing assistant. You're right, we do see patients beginning of life to end of life. We see some, as you said, some of the most joyous times in people's lives and some of the not so joyous times in their lives. And it's a very important role, I think, to be that person that gets to be very close to the people that they're taking care of, to be able to hear their worries, their fears, and to be that individual that is providing comfort to our patients, not just in the form of medications to make them feel better, but just that communicating and being there for people.
I was going to say, and that connection between nurses and their community is often pretty strong. I mean, in a community the size of Oskaloosa, everybody knows everybody, and so of course that takes things to the next level where I'm going to make sure my friend, my neighbor has the best care possible.
Absolutely.
Yeah.
That's a great thing about a community hospital. Everybody knows everyone. They know the people that they're taking care of. And they have a personal connection with the people that they're taking care of. Not just our nursing staff, but our staff that work in this organization are very involved in the community. They're the people that you see at your kids' sporting events. They're in your church. They're volunteering. They might be helping with the food bank. Just all of those opportunities to be in the community and then to foster those relationships when the patients are here.
So, I mean, we've talked about serving the community. We've talked about, the community needs. What other? I mean, Dr. Breon, you work hand in hand with nurses, and you see their specialty, you see their level of care. Talk to me a little bit about their importance that they have in the medical system.
I think you'll hear something mentioned a lot when you talk to people here. It's called the care team, and so there's so many people, and Andrea already alluded to the fact that that includes lab staff and maintenance workers and IT people and everybody, even the administrative team. But I view that the nursing staff and the nurse personnel as kind of a really vital part of the care team because they kind of pull a lot of the things together. So everybody knows when there's a question that nobody knows, you go ask the nurse because they usually have been working with all the other aspects of the care team intimately. And we as providers kind of rely on that heavily. And we just have a great group of nurses that are vested in the care of their patients, so much so that they really delve into the actions and activities as a really important leader of that care team. We think of the providers being the leader of that care team, and we take responsibility for that opportunity to be a leader of that care team, but we do that in conjunction with the great nursing staff that we have. And so it's really a pleasure to develop working relationship with nurses, and you work with them a while, and you work with them maybe outside of here in other functions, and you get to know those people, and it's almost like you motivate each other to provide better care just because of the concern you have for each other and the ability that you have to do greater things. We call it synergism, but two of you can do better things together than you could if you just add the two of you together. And there's something about that relationship that allows you to both rise above and do greater things than you could individually. So I think it's really it's one of the funnest things we get to do is work together with really cool nurses and cool care teams.
Awesome. So, I come out here, you guys help provide my care for me personally, and there's always some wonderful nurse that helps find me, lead me to where I need to go, because you doctors like mazes, I'm telling you just like mazes. So never find out where I'm going, so somebody leads me to where I need to go. They take my blood pressure, they do all those things, and we just kind of take it for granted. But I mean, that's all an important part of this. So that preventative care, those nurses also kind of help, fulfill that role and help doctors and staff and everybody and the patients, find the best care that they can then. So talk to me a little bit about why that's important, the preventative care and the role that nurses have in helping make sure the community is well taken care of.
Yeah, we have a great group of care managers in our clinic system here that are routinely reaching out to patients talking to patients about preventative care so that we can catch cancers earlier, so that we can catch diabetes earlier, so that we can catch many chronic illnesses earlier, so that patients can live a longer life, a longer, healthier life. And those care managers are the ones that are not only speaking with those patients, encouraging them to come in for well visits, helping them manage medications, getting them in to see Dr. Breon for preventative testing, colonoscopies, things like that.
And I think it's kind of cool when you work with nurses a bit, they catch on pretty quickly, and so they hear sometimes our spiels about preventive care. And I'll hear them saying some of the same things that I've said, they get that. And so consistency is really an important thing too with a care team. And so when they hear providers say something and then the nursing staff are saying the same thing, it starts to stick. And so I think being consistent with our message all the way through the care team and including the nurses and the providers is really helpful, and they're very helpful in doing that because you don't have to go tell them what to say. They just hear it and they start saying it themselves.
I was gonna say I know a couple nurses personally, and they, they're always looking out for you, even off the clock, so to speak. They're always looking out for their friends and neighbors. So it's great having those around. So I'm understanding there's 60 specialties that nurses help out with here at the facility. Is there something, or I know there's a bunch of nurses, so what, well over 100, 130 something like that?
Approximately 130 nurses within our organization. We are made up of registered nurses, licensed practical nurses. We have nursing assistants and medical assistants in the clinic. And we provide many different forms of nursing specialty. Of course, we have our hospice nurses. We have med-surg nurses. We have surgery and both pre-op and post-op nursing. We provide obstetrics, newborn care, emergency medicine, community health, public health, clinic nursing, infusion nursing. What am I missing here?
Well, I don't know. You guys keep adding new things and new services and new people coming to. So I'm sure it's a pretty busy time for you guys.
And cardiac care. I missed cardiac care.
We also, I think it's important to mention CNAs. So we have certified nursing assistants too, and a lot of those are motivated students that may be William Penn students, or they want to be RNs or LPNs someday, and they work here as CNAs as they're doing their education. So it's kind of cool to get those people in. And then it's neat to see what some of those do once they go on and advance their education too, or they get interested in medicine more just as a CNA. And so it's neat to have some of those motivated people here too.
Absolutely. With tomorrow, starting National Nurses Week or Month and Hospital Week being next week, we want to celebrate all of our team members in this organization, and especially our nurses. So we have a host of activities planned over the next week to celebrate those individuals. Tomorrow we'll be at City Hall at 3:30 with the mayor, where he'll sign a proclamation proclaiming National Nurses Month and recognizing all of the nurses in the community, not just those that work for Mahaska Health, but we've invited nurses from the school system, from our long-term care partners, and behavioral health partners here in the community, and home health agencies. So we'll be doing that tomorrow. My big theme with nurses every year as we start thinking about Nurses Week is I want us to think about how we can educate, celebrate, and give back. So we educate our staff. We bring in different schools that can talk about furthering their education, educate in the community. We give back by, we always do a fundraiser every year for nursing scholarships. And this year we're going to have a dunk tank. So that'll be fun. I'm trying to talk Dr. Breon here into getting in the dunk tank for us.
I think I see dimples.
I'm too tall to go under the water. So.
He probably is. Yeah, we usually get some different nursing leaders and providers to participate in some fun activities that people donate money to, and then we put that into the foundation, and then that money comes back every year in the form of nursing scholarships for nurses that work in the organization that want to further their education, whether that be a degree in nursing leadership or nursing education, or if they want to become an advanced practice nurse, like a nurse practitioner. So we also celebrate with lots of food.
All right.
So that's our favorite thing.
I could handle that.
Yeah.
I think too, an important part of this is, everybody likes to be celebrated. Mother's Day is coming up, and we want to celebrate our mothers, but mothers are happier about having their kids come over for Mother's Day than they are anything we can give them. And so I think nurses are the same way about the opportunity to care. It's cool to celebrate them and take them up to the courthouse and stuff, but I think the coolest thing is when they see people come back that have had a good experience here, and they've been a part of that, and they're doing well. Those are special times of celebration that, make us as a care team keep doing what we're doing. So I think, the opportunity that we have to provide care for anybody in our community that desires to come here for that, we relish that, and we take advantage of that. And then when people do well, which we hope everybody does, but when they do well and they come back and they're thankful for that, that's the greatest thing for nurses, providers, anybody in the care team. And so, our mission really is to provide care for anything that we have the resources for here, and those resources are growing daily. Anybody that we have the providers and the nurses for, and then to do that in a way that they know that we care about them as a person more than just their illness. And then it's so cool and so rewarding for us to have them come back and be doing better and appreciative of the care that they've received here. And so it's such a special time in healthcare right now, and I don't have to get into that. People know what I'm talking about. But the need for medical services has grown in the last few years, and the inability for some communities to be able to provide those needs has really been a challenge. And so that's something that we understand, and that we're doing all we can to meet those needs now more than ever, and developing a culture that's all about that, and developing care teams that are signed up to do that together, and also just a group of providers and administration and the entire group of people that work here from top to bottom just sold out for the opportunity that we have to make an impact in the life of those people that live in our community or surrounding communities that want to come here for their care. So, exciting time.
All right. Thank you both very much.